Hello and welcome back to ESICON 2018 in conversation with Dr. Ashraf Ganie all the way from Srinagar. He is a professor of endocrinology department at SKIMS Srinagar. Sir, welcome on board.
Hi.
How are you doing and how has your experience been so far with us as far as the Endocrine Society of India is concerned here at ESICON 2018?
I am fine. There's a beautiful city and beautiful arrangement made here. I am very happy, and there are a lot of scientific activities happening.
Absolutely.
And, yeah.
Is this the first visit to Bhubaneswar?
No, I have been coming for other meetings as well.
Great, great. To begin with, sir, ESICON 2018, as you rightly mentioned, a long agenda spread across so many halls, so many faculty members coming in, pan-India, and international speakers on board with us. However, we also have had many interactive initiatives this time. The EPL was a grand debate contest that was organized on day one. Yesterday witnessed the Panchayat session, and sports, endocrinology, and many more aspects to it have been covered this year. So how does this entire experience come to you as a learning process along with some cultural extravaganza and a fun way to learn things?
Yeah, I know I am one of the senior members of endocrinology, and from 1919, almost in last 10, you can say 20 years, I have been actually witnessing the developments, and it is very good. It is heartening that endocrinology society is expanding, its influence is expanding, and the various new developments for the country are happening is very good.
Sure, doctor. Thank you so much. And now let's talk about the session that you spoke for, and that was PCOS in India. Quite a serious concern. Let us begin with what do you have to say. How was the session? A quick overview about the session as far as PCOS is concerned in India.
See, I have been actually working on polycystic ovary syndrome for last 20 years. But as you know, the name signifies that it is a cyst in ovaries, and that has led to a very serious issue in the public as well as clinicians. They think that this disorder is just cysts in ovaries and it is a gynae disorder. What is important about this disorder is that it is a more of a metabolic condition, and it concerns various specialties like endocrinology as the top of it. Then there are other specialties, for example, gastroenterology. A PCOS patient goes to gastroenterology when they develop fatty liver or other GI problems. They go to pulmonary medicine when they develop sleep apnea. They go to bariatric surgeon when they have morbid obesity, and they may go to actually gynecologists when they do not conceive. They may go to dermatologists when they get hair growth or hair loss on the scalp, and so on and so forth, because the presentations are varied. This is a multi-specialty disorder. But unfortunately, the name is little misleading. We are actually thinking, my discussion is always focusing on that we should rename this condition so that it gives the idea that this is a metabolic condition. In this endeavor, I spoke on my lecture that we have started a new society on this disease that is called Metabolic Syndrome Pre-Diabetes PCOS Society, which is a long name, apparently looks difficult for people, but the idea was that this society will itself, its name will give idea to people. No, this is not a condition limited to one set of clinicians. It affects actually people across the board, and these patients reach to so many clinicians.
Sure. Thank you so much, sir. And also understanding, I'm trying to understand, and our viewers, let's have a word on what are the causes why PCOS remains undiagnosed in our nation. What are the factors to it?
See, you know, our society in this country, even 50% of type 2 diabetes are undiagnosed. And my understanding is that PCOS is not different from diabetes. I consider it is the early beginning of diabetes actually. Now, we do not also think that it is only limited to women. We think it is just expanding to men as well. However, in men, there will be different metabolic traits. They will not have hair growth and menstrual irregularity, but they will have same metabolic issues which happen in women. Now, cultural factors make women, especially adolescent girls and young ladies, to hide their problems, because they get ridiculed if they have hair growth or they have hair fall. They try to cover it up. If they have menstrual irregularity, they do not say, because of the risk of family problems after marriage. They do not disclose that they have this problem, because there's many women I have seen, when they have infertility, they get divorced.
Yeah.
So there are all those issues, and more than this, there are psychiatric problems, depression and other psychiatric problems very higher in this class of patients. That is because of hormonal imbalance, and those issues being added to it. And then there is significantly large number of people who are not aware of the condition. We need to spread awareness. They are not aware that this is an abnormality. They think it will settle off their own. So those are the issues.
Sure. Now let's talk about what kind of current advances or treatments have been introduced, and also, since it is so common, I would like to understand that what kind of efforts now would be taken care of for PCOS in our nation.
Yes, see, regarding treatment, I will tell you globally, there was a significant change. Initially, people would treat it as gynecological disorder. Oral contraceptive pills were given that would help in acne, pimples, that would happen in unwanted hair growth, and that will help in regularizing cycles. Now subsequently, people also thought that their conception rates can improve. They used to give clomiphene, but there was a significant change in 2000 or 1990s. That it was considered to be an insulin resistant condition like diabetes. That is how insulin sensitizers have entered into PCOS management. And there has been a significant data on metformin. So metformin is used very, very rampantly, and it helps though. Thiazolidine like pioglitazone is used. There is another insulin sensitizer like chiroinositol or myoinositol. Then there are new drugs we are trying, even SGLT2 inhibitors like gliflozins, DAPA or empagliflozin. We are trying those currently. Then we give anti-androgens. In fact, there are several other drugs in addition to OCPs which are being currently tried. So we are doing some studies where we want that the choices of therapy increase in this class of patients. Responding to your second question, what initiatives we are taking in this country? See, I have been doing at my own level some studies like at AIIMS New Delhi, where I was initially posted, and we have done some studies there. And now currently I am at Sher-e Kashmir Institute of Medical Sciences. We have been doing some studies there also with collaboration of other colleagues. So we have a database of more than 4,000-5,000 PCOS subjects, and we have tried various modalities of treatment. And we have learned a little bit in this, but however, I always felt that there is India is not one country. It is a big country, and there are multiple ethnic groups.
Absolutely.
And there we have also found a variation in the presentations, variation in the treatment responses and all. So to counter that, we have actually been fortunate, and we are thankful to the government of India. Indian Council of Medical Research has supported us with a not that high grant, at least some multi-crore grant, some 10 crore grant, to support a study where we have selected multiple centers in the country from all zones. We are currently having 10 centers which we are planning to expand. We want to study the risk factors. We also want to study what are the differences between regions and what is the burden of the disease. And what are, like I told you, diabetes, it is like diabetes. and what is the risk of diabetes, what is the coronary artery, what is the cancer risk, what is the sleep apnea risk, and all those things we want to see. And in 2 to 3 years time we will have data enough to tell the world that how is Indian PCOS different and what are the issues.
Sure. Thank you so much, sir, and wish you all the best with the initiative that you have already taken up as your responsibility towards our nation. Well, thank you so much for joining us on ESI TV. Thank you once again.
Thank you very much.